Bienvenidos al quinto Congreso Mundial de Sexología Médica. Este congreso es patrocinado por
Sexual pain disorders are the most common genital pain conditions in women, with prevalent rate estimated about 12%. Recently, the DSM-5 established the diagnosis of genitopelvic pain penetration disorder, GPPD, to replace the separate diagnosis of dyspareunia and vaginismo, which is welcomed by many authors, despite considering two parts of the same continuum is not always possible. For instance, it can be observed that in women with vaginismus, in contrast to those with dyspareunia, there is a penetration-discuss association and a marked difference regarding the response to pelvic examination. It would be necessary to agree or disagree with the criteria of GPPD, at least in the field of psychiatry and psychology, to adjust to the DSM-5 criteria, despite some authors believe that GPPD does not accurately describe the symptomatology of lifelong vaginismus. Recent research confirms that GPPD provokes occasional impossibility for penetration, as well as problems with sexual interest, decreased sexual arousal, difficulties at reaching orgasm, and avoidance in some forms of intimacy. As a consequence, male pain partners reported significantly poorer sexual communication and erectile function, as well as less sexual satisfaction. Provoked vestibulodynia, PVD, and vaginismus interfere in parity and mode of delivery. These women were more likely to be unmarried, unemployed, have a higher educational level, a lower body mass index, and less likely to give birth. Women with vaginismo or PVD more often delivered by cesarean section. In women having vaginal delivery, those with vaginismo or PVD were more likely to suffer from a perineal laceration. There are so many factors that act as predisposing, precipitant, or maintaining of GPPD. During the past 18 months, different researches have been carried out focused on the pressure pain threshold. For example, in patients with dyspareunia, the number of tender points were significantly higher, and 12% of the patients with dyspareunia were diagnosed with fibromyalgia, whereas no patient in the control group had this diagnosis. A recent research highlights how autonomic genitopelvic reflexes are activated in reaction to emotional stimuli, such as disgust, anxiety, and fear. Nevertheless, there isn't any difference in the brain responses to penetration stimuli between females with and without vaginismo, assessed by functional magnetic resonance imaging. Attachment style is a fashion variable studied in multiple investigations. In our case, a sample with vaginismo shows significantly lower for secure attachment scores than in the healthy group. An interesting paper assessed the sexual response in drug abusers. Women abusers show a higher rate in the vaginismo scale than in non-consumers, higher score in sexual avoidance, and worse sexual attitude. Fortunately, there are new effective strategies of treatment. A new program of treatment called Multidisciplinary Vulvodynia Program has been elaborated with good results. Another treatment based on the fear avoidance model highlighted the relevance of pain self-efficacy. A training in pain self-efficacy could be the most important tool to resolve the problem. Taking into account couples, a novel cognitive behavioral couple therapy for couples coping with PVD implies significant improvement in women's pain and sexuality outcomes for both women and partners. Unfortunately, nowadays, there is not enough evidence in supporting the choice of the best treatment.
Este congreso es patrocinado por